Hi guys, welcome back to the channel. And today, what we are going to be discussing is a very frequently asked, very frequently requested video in which I'll be giving you some topics of obs and gynae, which I noted after solving and looking at past 3 years of paper for FMG. And this is what I came up with. It is not exclusive, but most of the questions, like 32, 33 questions about come from gynae ops, and I have given you 25, about 24, 25 topics. And most of the question, like 90% of the question, would fall from these topics only. So if you can read and revise these topics, you are good to go for your FMG 4th of June exam. So let's get started without wasting any much time. So first thing is support of genital organs. One question of anatomy is always asked in gynecology and ops question, and most often it's the uterine support or this. Basically, it's focusing on the support system of the genital organ. So be sure you make a good revision of it, and it's a little bit difficult to remember. It's a little bit ratta kind of question, so you have to revise it over and over. Next, second is Bethesda system. So first we are done. Second is your Bethesda system of cytological reports. You have to remember this. This one is done. Then another one is vaginal pH at different stages of age. So basically, reproductive age, menopausal age, there are different pH variations in pH. You need to know this. One-liners can, and most oftenly, many times, one-liners have been there regarding this topic. Next is Bartholin cyst. Bartholin cyst have been asked a lot of times, so please make sure you know what is Bartholin cyst and what is the choice of treatment, like what procedure they do. So that is important as well. Then stages of labor with the duration is also important because they ask questions, clinical questions with it too. Hormones in pregnancy and hormones in menopause are very important, guys. Do not miss out on the hormones. Signs in pregnancy, very, very important. One question definitely would come. Ovarian tumor and the histopathological findings of ovarian tumor, very important. All about abortion and MTP, the types of abortion, what happened to the cervical os, and those things like the details. I'm sure if you have done your gynae ops, you must be aware of the table, the missed abortion, the threatened abortion, and all those things. And MTP, you have to know about the MTP. All about PIH, pregnancy-induced hypertension, and health syndrome. Very important, cannot be focused more. PCOD these days is a very common problem among women, reproductive age women. So they are making it more clinical. So I'm most probably some clinical question would come from PCOD. So please take care of it. Contraception, very, very important. If you leave contraception and go, you're leaving 2-3 marks straight away. If you do contraception here, then your contraception from your PSM portion is also done. So please be thorough with your contraception chapter. Next, vaginal discharge, very important. The infection, the color, the there are like some points like the catchers. They would put that word, and if that word is in the question, in the clinical question, it can be nothing else. Like the curdy discharge है, तो candidial है. ऐसा करके there are many questions like that. Like 4-5 में हो जाएगा. You have to just make a table and look at the like question giveaways, the keywords of it. So, and it will be very easy. You don't have to like mug up everything about it. Then drug of choice in pregnancy is very important. There are a lot of drugs used in pregnancy in various stages, and drug of choice should be known because most often they love to ask drug of choice in pregnancy. I can make a video on it as well if you want. Most probably I'll have a little bit time for a few days. So if you want, please comment in the comment box and let me know if you want the drug of choice in pregnancy ka list. We would discuss it as short and sweetly as possible. चलो नेक्स्ट 15 इज प्लेसेंटा. प्लेसेंटा भी बहुत जरूरी है. अम्बिलिकल कॉर्ड रिलेशन विद प्लेसेंटा, द बैटल डो एंड स्टफ. और आपका एक्रेटा एब्रप्शियो इज इम्पोर्टेंट. देन सर्कमवेलेट वर्सेस सर्कममार्जिनेट भी बहुत इंपॉर्टेंट है. दे ऑफन आस्क लाइक इमेज बेस्ड क्वेश्चंस ऑन इट. Twin pregnancy is also very important. It is a small topic, but it's a very important topic. Every alternate year, एक साल छोड़ के एक साल, एक बार छोड़ के एक साल, every alternate question year they ask a twin pregnancy का question. So please make sure you read it and do not leave this small but sweet and high yielding topic. Reasons for oligo and polyhydramnios. One question for sure. Something of oligo or poly will definitely come. You cannot ignore it and go. Cervical cancer. Whole of the cervical cancer is very important. If you have to study some cancer, please study cervical cancer among OBG. NTD, neural tube defect, its management, investigation, everything is extremely important. You have to know this. Ectopic pregnancy, I think we all are aware of ectopic pregnancy. Most commonly, they'll ask the most common location and which IUD. They mix up they mix up the contraception and ectopic pregnancy ka question as well. So make sure while you're studying the contraception part, you see that which one increases the risk of ectopic pregnancy and which one does not. Make sure of it. Then diabetes is very important, which includes like overt diabetes and gestational diabetes. So the definition and the criteria is very important. Key, what is the criteria for investigation and diagnosis? Second, the definitions are very important. They can give you in definition options, a lot of options, and then they can ask you to mark the correct one. So before how many weeks, after how many weeks it's considered, what is the value, before what value it's considered overt, like after what value it's considered GDM. You have to be very particular about these things. Drug of choice for infections in pregnancy is also very important. To be very honest, total of the infections in pregnancy is very important, so you have to be aware of it. Reproductive physiology में you I would want you reproductive physiology is a little for me, I find it's a little bit easy thing because we have read it a lot of time, but you may not be finding it very easy. For those who people do not find it easy, please make sure you know all the hormones in reproductive physiology, all the functions of the hormones, be it male or female. The second thing I want you to know is the weeks, कि कितने weeks में weeks and days, I mean the number things. So one liners will come from it कि capacitation में कितना time लगता है, then fertilization कौन से दिन होता है, then implantation happens on what day. These things would come. Okay, maximum uh, follicles female oocytes का कब होता है, what age पे होता है. These kind of questions, like the facts kind of question would come, so be sure of it. Next is your pap smear. Pap smear is very important because it's clinical as well. So they would ask you something practical too, which would make you think. If you have a little bit of knowledge, you'd be able to do. So make sure you know your pap smear procedure, indication, everything. Then your FIGO staging for vulvar cancer. So this is also important. So make sure you know this. So that's all, guys. This is the list. I have like 25 topics, out of which like 33, 34 question would be made in your obs gynae question paper. So I hope you find it useful, and I hope I kept it as short as I could. I don't want to waste any much of your time. Please keep following. And if you want, I keep uploading some files and important topic data and important things in my Telegram page, and we also share and talk about things on my Instagram page. So the link for everything is down below. Please go and find it out and check it out. If you like it, please follow and add on to the group, and I'm sure it will be very helpful for you. So thank you so much for listening, guys. I'll see you next in another high yield topic video. I'll solve some of the question for some topics, and we'll come up with another video for your 2022 important topic list. Thank you. Signing off. See you later.